and I got the pelvic till on the left side, and I start to get problems over here in my chest, intercostal muscle, and my diaphragma, and my shoulders and my neck. Yeah, sometimes I get a little bit dizzy. I get trigger points all over my arms and my feet, over here.
That's Patricia. She helps out older people by cleaning around the house and serving them food. And just like a lot of you,
Yeah, I don't know where to start. I'm confused and yeah.
now a lot of us do end up having something like trigger points or just pain all over, especially as we get older. And I know a lot of us try to figure out why this happens. So in this video, I'm going to be explaining why we get pain all over, how a simple accident can lead to a spiral effect of pain, how to properly massage out your tight muscles so you can actually get rid of your pain fast, and my secret 3R system for getting rid of your TOS in record
Going to
time.
get started, please go and just tell me your name and tell me a little bit about your situation. I have all your notes here. I'm just going to kind of go through it with you and make sure I don't miss anything.
Yeah, my name is Patricia. I'm 74 years old and I'm from Germany. And I work at I work with old people and do some stuff in cleaning and do I'm a lot of walking around, you know. I'm on my feet the whole day. My English is not so good. I hope you understand me.
No problem, no problem.
That's good, yeah. Yeah. So I write you a lot of emails, right?
Yes.
Because of my accident with my leg, I get tightness on my leg all the time. It's so tight, and my myof myofascial chain is tendons everywhere, you know. And I don't know how to start, and I don't know which muscle is too weak or too strong or too short. And I got the pelvic till on the left side, you know, and I start to get problems over here in my chest with the intercostal muscle and my diaphragma and my shoulders and my neck. Yeah, sometimes I get a little bit dizzy, and yeah, I get trigger points all over my arms and my feet, over here. Yeah, I don't know where to start. I'm confused and yeah.
Okay. Um, let's start with the accident. You tell me that you were walking your bike across the street and you ended up falling. Is that correct?
Yeah. My bike was falling down. I wanna pick it up like on like this, and I feel the pain right here. And since then, I got this tightness on my uh over here.
All right, so let's quickly talk about if it was actually the accident that left Patricia with all that pain, or if it was something prior, which obviously I do believe is something prior. When we have these kind of injuries and then we explain it to our doctor, most of the time they're going to look at what that actual cause was. But in my opinion, picking up a bike shouldn't create a cascade of problems, especially when you do have some prior medical history, which we'll get to in a minute. So with that said, if you are someone who gets injured or got injured by just stepping up a curve or picking up a bike, doing something small that you've done every single day prior without any injuries, then maybe you need to look in your past, look in your history, look at your patterns to begin to try to figure out what's really happening.
And on this side, on the TFL, maybe, I don't know, this band over here, you
IT
know.
band.
Yeah, genau. And when I be on the Faszienrolle and I roll it and it's hurt so badly, I started crying. I don't know what's gonna do. I'm so in pain. And when I do the massage, I'm in pain, and I don't know if I do it wrong or right. And I don't know. One day I do this or the other do. I don't know which way to start. I'm confused and I'm really scared. Yeah.
So when it comes, so you're picking up the bike, and as you were picking it up, you just randomly felt pain in your back, and then all of this in your lower back, and then all of a sudden your leg hurts, or was it the hip that felt it?
Over here, the ESG, Gelenk. I got all my problems of the left side, anyways. And a little bit here, it starts to here, the intercostal muscle. And I went to the doctor, and he said my bone is not really in my hip over here. Yeah. I think
How did
all the
that happen?
problems, maybe because I got this anterior pill, this pelvic, because my hip is like it's not right, and it's turned a little bit. Maybe because of the scoliosis I have, maybe, I don't know.
Maybe.
Yeah.
Um, so your hip, having your hip displaced it's hard
No.
for that to happen. Is it just elevated on one side? Is it
Yeah,
just
it's
a lateral
elevated.
tilt?
Yeah,
Okay, okay. And left
yeah,
side up.
yeah. It's the
Are you
muscle, I
lefty?
think. Everything is the muscle. Yeah,
Are you a lefty or righty?
right.
Okay. Interesting.
Now, pause here quick, right? If we take a look at Patricia's posture, we can actually see that her left side is lower than her right. And that is a huge indicator to me that they're usually left-handed. Now, I'm obviously wrong here in this situation. That's why I asked her. But if you are a lefty or a righty for obviously 90% of the population, then expect that dominant side to be stronger, to be tighter than the other side, creating some kind of pulling effect. I myself am a lefty, and you can see that my left shoulder is slightly lower than my right, and that is completely normal. Just like most of you righties out there are going to have a right shoulder lower than your left. And again, this is just a simple little basic pattern that ends up happening to a lot of us, which usually creates a cascade effect going down the body that you'll see when I get to the anatomy.
You do a lot of daycare too, right? For
Hmm?
adults. You work with adults,
Yes.
helping them out and all that.
No, I'm not I don't do I just do carried around other stuff on this house,
Ah, okay. You clean the
Yeah.
stuff, you don't take care of them.
No, yeah.
Okay, okay. Just wanna double check. How often do you do that every day?
Every day. Not I got 2 days off of the week, or but always on my feet and walking a lot around, and look, the house looks nice, or I do the how you call it, um we got a coffee, and we do a service like this. The people come here and
Okay.
eat a cake and stuff,
Uh,
and we do a lot of not parties, but we do how you call it, um my English. I'm walking a lot around, and I do laundry, you know, and
I
all this
understand.
stuff. Yeah.
Now, if you actually just stop and take a look at what you do for a living, actually just take a look at what everybody does for a living and the body positions we're constantly put in, you're going to see that most of us, 99% of us, are going to be in this position where we have to use our arms in this kind of motion, in some kind of motion here, position, we'll call it. So for example, you can use, most of us are going to be typing in this way. You might be working lower here. You might be an electrician and working on lights. But the point is, because everything we do is in front of us, in front of the body, these muscles in the front of the body are the ones that usually end up getting tighter and the ones that create the issues.
Okay. Tell me about your history. What did you do growing up? Did you have any previous injuries? What was your previous job? All that kind of stuff. Anything like that? Anything that comes to mind that pops
Not,
out?
um, no, I was working before I learned in a shop with pictures, and I do that. And my sister, she go to the States. I was 16, and then I start problem. I got a Bandscheibenvorfall on here.
Okay.
Bandscheibenvorfall. I don't know what it is in English. I go to the MRT and they see I got a Bandscheibenvorfall.
You told me you mentioned scoliosis earlier.
Yeah,
Is this similar to that?
I think so. Yeah.
Okay. And is that in the hips or is that the spine too?
I mean the spine. I got a spine. They call it Bandscheibenvorfall. Let me see. Wait a minute.
No problem.
Okay. A nested disc.
Herniated disc.
Yeah,
Okay.
but not really. It was before, It was not out, but it was before. I got it 2 times in my life, and then I was to exercise and stuff, and that was okay, you know. Yeah.
So I'm asking because to me it sounds like you had the lateral tilt in your hips
hmm
before the injury, and what
hmm
you did leaning over probably pulled something a little too much or squeezed something a little too much. And then that it was the last straw, the last little piece to hurt you after years and years of always being like that. And I'm trying to wonder what it was that maybe gave you a lateral tilt to begin with. I know you said you have scoliosis. Were you born with that, or did you develop that?
Um, Somebody told me I was just when I'm sleeping, I always lay like this, maybe. I don't know. My muscles are, yeah, I don't know,
Someone
just what
told
he
you, or a doctor told you?
No, he was a trainer and he told me that maybe that's why, and you do the muscle stretch and this, and but it's not working, because I got so much trigger points, maybe, I don't know.
Okay. Okay. So you're not sure if you have scoliosis, but it's a maybe.
So I got the scoliosis, I got on paper, yeah.
Okay. 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 I just want,
Yeah,
okay,
yeah.
I'll try and make sure.
Yeah.
Okay, so that could be one big reason, and an obvious reason for why your hips are tilted. What
hmm
I'm trying to think here is your TOS and then the rest of the pain. So your work, all of our work, sadly, because it's everything we do is in front of us, you clean everything, you're always using your arms, you get to
hmm
serve and hold weights. These muscles are always contracting, always tightening. They
hmm
always think you're in the gym, you just don't have any weights. You're not
Yeah.
getting stronger, but they do get tighter. And because of that, they can end up creating that thoracic outlet syndrome, the TOS, the compression. So every
hmm
time you use your arms now, those nerves are getting squeezed,
hmm
and that creates your pain.
Okay.
Now, let me show you, let me pull up some anatomy.
Yeah.
Do you see this?
Yeah.
Awesome. Let's see. So what ends up happening is because we end up using these muscles all up here in the front of the chest, the neck, the intercostals, and all that kind of stuff, these muscles will shorten and get shorter and shorter. And because of that, the joints around them have to move with it. They can't just not move, right? Otherwise, the muscle's going to tear.
Yeah.
Well, with that, those joints also attach to other muscles in the back, like these other levator scapes, the neck, the rhomboids, the shoulder muscles, the rotator cuffs, all that kind of fun stuff. And because of
Mm-hmm.
that gets pulled with it, and that right there is what ends up creating a lot of that pain in the back.
Mm-hmm.
So, for example, if you have thoracic syndrome, you probably also have some kind of upper back pain every now and then. And that's usually because this is tight, pulling it,
Mm-hmm.
creating that stretched out tightness. So one is short and tight, and the other one
Mm-hmm.
is stretched out tight.
Mm-hmm.
So your lower back, I know you're pointing at your lower back. The opposite is basically true, where this part now is all shortened and all that. But now this side is stretched out tight.
Mm-hmm. Oh.
And this pattern just keeps happening throughout the body. So you can look at the pattern starting in the front, going tight, 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 tight. You can look at it going left to right, like tight here, tight this side, tight this side, tight this side. You can look at it from the top, tight this way and tight this way. And then, of course, you can look at it as a combination of
Mm-hmm.
literally all of that.
Let's take a look at the anatomy here. When you're looking at your anatomy, you have to take a look at the agonist-antagonist relationships between the muscles that you're actually trying to focus on. So for example, if you have chronic pain in your upper back, then you have to ask yourself, what is the agonist/antagonist relationship? If the rhomboids are your agonist, what is the antagonist? What is the opposite muscle here? That is basically what it means. So in this case, that is going to be your pec minor, which I think we all know in this situation, your pec minor can create a lot of tightness and pain for TOS and nerve compression in general. So you have to ask yourself, if one is lengthened, that means the other one has to be shortened and vice versa. So if your rhomboid, the agonist, is lengthened because you're trying to strengthen it with your PT, which is usually the case, then you have to kind of figure out that, hey, that probably means the antagonist here, the pec minor, is most likely shortened. And that's something you might want to address. On top of that, just ignoring the muscles for a second, if we take a look at the fascia around it, around everything, it is the fascia that is technically getting tight and restrictive, not necessarily the muscle, because it is the fascia that wraps around it like shrink wrap, it tightens it, but it also goes through the muscle. And when it goes through all these fibers, it's going to go through the end of one muscle into another muscle into another muscle through that entire chain. So it is the fascia technically that's getting tight, shrink wrapping those muscles and making them either weakened or shortened or tightened, however you want to call this. So in order to take advantage of this information, take a look at what exercises your PT gives you for your pain, any kind of pain in general, right? Because they're exercises, they're safe to do. And then think about the opposite muscles and then the opposite treatment, which in this case is going to be self-massage. If you have your PT training your upper back, massage the chest. If your PT is trying to strengthen your core, release the lower back. Think of it in this kind of pattern right now in order to try to figure it out, especially if you're not good with which muscles go with which in terms of agonist, antagonist, and all those kind of things. Oh, and by the way, if you're finding this extremely useful, don't forget to hit that like and subscribe button. It definitely...
Okay.
So what it sounds like to you is there's a lot of some tight shit and a lot of some small spots here and there.
Yeah.
What
I'm
I
a
think
mess.
is happening. Yes, it sounds like it's
Yeah.
what it sounds like, honestly, is a lot of the muscles you're pointing to are a lot of those muscles that tend to become either overworked because they're overused, or they're the muscles that get super stretched out because they're not strong enough to support it.
Mm-hmm.
So with that said, I saw in here you have some issues with massaging and exercising and which ones to do what.
Mm-hmm.
Starting with massage,
Mm-hmm.
if a muscle is tight, if a muscle has trigger points, it's going to be most likely uncomfortable and painful. And
Okay.
it's just something you kind of have to put up with for a bit.
Okay.
So, for example,
Mm-hmm.
the SCM muscle, the neck
Yeah.
muscle, usually very tender
Yeah.
on people. I play
Mm-hmm.
with this every day out of boredom.
Okay.
The more
Okay.
you work on it, the less it gets tender. It's very wrapped up in fascia. There's layers and layers of this fascia connective tissue, the
Mm-hmm.
myofascia. The fascia has a lot of nerves in it, and all those layers are nerves, and you're trying to kind of just loosen it all up. You're just not breaking it, it's letting it slide. So
Mm-hmm.
everything right here is stuck and it moves together, and you feel every little stretch. And we needed to do this.
Okay.
So that's what these massage techniques are. So the best thing to do when you find that tenderness, that pain,
Yeah.
you hold it for a little while. You got to hold it for at least 30 seconds. I would say probably a minute. But the pain cannot be a lot. It can't be to the point you're not breathing anymore.
Okay.
If you're tenting because it hurts so much, then the muscle is tenting too.
Okay.
You have to be
Um,
able to breathe, but it's going to be a little uncomfortable. So you have to
mhm.
breathe through the pain for a bit, for a minute, and you'll feel it relax. You'll feel it. You might feel it move, and that's very normal.
Okay.
These are
Okay.
all signs. These are all signs that these muscles are very tight and they need to
Mhm.
be released because muscles should not hurt. They should
Mhm.
not create pain in other areas when you press on them. They
Mhm.
shouldn't. So
Mhm.
if it hurts and it does that, it just probably means they're very tight.
Okay. Yeah. I
And
understand.
it
Yeah.
sounds and it sounds like
Yeah.
everything's tight on you right now.
Yeah.
Front to the
Yeah.
back, and it's all because of that fascia. Go ahead.
Yeah. No, I was listening to you. That's okay. I understand you. I understand more than I can speak. That's okay.
Okay, no problem.
All right, let me just kind of reiterate this real quick, right? When you are doing a technique, especially a self-massage technique, regardless of what kind of tool you're using here, the goal is to help the tissues slide on top of each other, not necessarily become ripped apart or broken, basically. We want the tissues to easily slide, which allows the tissues to easily move. So think of it when your muscle is shrink wrapped and the fascia around it is tight on it. The muscle can't move by itself, right? It slides with the fascia. But after releasing it, the idea of releasing it is to actually help it slide on top of each other, which allows easier movements. With the biggest key being you must breathe. You must be able to relax, but also take yourself to that kind of uncomfortable situation. Just like anything in life, right? It's good that we're a little bit outside our comfort zone, but we shouldn't be going to the extreme. Same situation applies here when it comes to massaging out your muscles. You need to think of it like I'm getting to that kind of intense feeling, but I'm not going to the point where I'm holding my breath. Because if you're tensing because it's hurting too much while massaging the muscle out, then the muscle is also going to be tensing, which is the opposite of what we're trying to do. This is probably the biggest takeaway if you're going to be doing any sort of real self-massage techniques. Make sure you are able to breathe throughout the pain.
Yeah.
So again,
Yeah.
so yeah, those muscles, even the muscles you have to exercise right now, they also need to be massaged out because the same way how the shortened muscles get wrapped in the fascia, the long muscles get wrapped in the fascia, and they
Mm.
need they need space to move too.
Mm-hmm. Okay.
So everything needs to get massaged at the moment, in
Mm-hmm.
my
Okay.
opinion. And
Okay.
then once and this takes a couple of weeks. This can take a few months if you're not doing it every day, and depending how tight you are, which muscles you're using. There's a lot of factors, obviously.
Mm-hmm.
But once those muscles are released, you feel maybe less tension.
Mm-hmm.
Then you go into the stretches and the exercises for those muscles like the back, the stomach, the butt, all those ones your trainers and all that kind of give you. That's when you go back to that because now those muscles are loose. They can now move and it makes it easier for them to get stronger.
Mm-hmm.
On,
Okay.
on top of that, when all this is tight, those
Mm-hmm.
muscles they can't pull, they can't get stronger because these are tight, they're locked short.
Mm-hmm.
So by opening this becomes way easier to get stronger. You get stronger faster, and the pain stays away a lot longer.
Ah, okay. All right. I
So
understand.
think of massage as the way to get rid of pain, and exercise is the way to keep your pain away, is the
All right.
prevention.
Okay.
But you have to
Yeah.
get rid of it first before you prevent it. You can't prevent it if it's here. It's already
Ah,
here.
okay.
You got to get rid of it first. So that's where the massage comes in.
Mm-hmm.
Does
Okay.
that make sense?
Yeah.
So it
Yeah.
sounds like you kind of have an idea of what you're doing. You just kind of got to stick with it, and whatever you think you're doing, maybe double the time.
Yeah.
I find a lot of
Yeah.
people kind of they poke around, it hurts. I do this for 10 seconds and they stop. And pretend I'm working on you. And if I did
Mhm.
that for 10 seconds and I moved on, you wouldn't be happy. You
Okay.
would hate it.
All right. Yeah.
Pretend you're paying someone to do it and you got to spend 5 minutes, maybe 10 minutes massaging it out. Get those tender spots out, really work them. Pretend like
Hmm.
someone's here working on you and you're taking that time for all those small muscles. For people, just for this part, I could take 90 minutes just for this. 45 minutes
Hmm.
for this, 45 minutes for this part, and that's it. And then maybe that's just one day. And then next day you try the back, next day you try the arms. It's
Okay.
going to be a work in progress, and you have to try to keep notes, how you're feeling the next day. Expect to feel sore. That's
All
normal.
right. Okay. Oh.
Yes. So
Okay.
it's one of those things you have to just kind of really get into it and invest your time with it. Put on a movie and just enjoy the massage, you know?
Mm-hmm. Yeah. Okay. Yeah. I
You have
understand.
any questions?
Um, okay, I do one day I do this massage and this massage, and you got a lot of videos on YouTube because of the hips and uh psoas muscle and over there. I have to use these videos or you got a program for this too.
So I do have a program. Have you seen the 28-day challenge, me mentioning it in any of the videos?
Uh for the toss I saw it, yeah.
Correct. So
Ah,
the
okay.
thoracic outlet syndrome, it's a 4-week program.
Mm-hmm.
The first 2 weeks is a lot of massaging, and then the last 2 weeks you move into the exercises. So it starts off with heavy massage, lots of massage, and very little exercise. And then when you start getting towards the end of the program, they start to reverse. So you're
Mm-hmm.
now hopefully a lot of the pain's gone, and then hopefully you're ready to get rid of it. Sometimes people
Mm-hmm.
need to do this for the week 1, 2, a few times, but the program, that's how it kind of runs. It's each session 60 to 90 minutes. So it's as if I'm
Yeah.
really working on you. So you're spending that full 5 minutes on the chest, 5 minutes on the pec minor, 5 minutes on the neck, and you're just following along with what I'm doing.
Mm-hmm.
With
Okay.
that also comes with the rounded shoulders rehab program. And the reason I bring that up is because that is a 3-month program. It is a very long program. But I bring it up because we work on the hips as well, on the psoas and all that kind of stuff, because you need to work
Mhm.
on that lower body pelvic tilt to work on the upper body as well. So we do
Mhm.
work on that as well. So you don't need to go through the full program. I can't tell you which one is the lower body. I don't remember at the moment. But you
Yeah.
can just go into that program because it's free when you buy the TOS. And you can just look for the lower body portions and just do those.
Okay. Just first the massage, that is, and then after this, for a couple weeks, you said, right?
Yes.
Ah, okay. All right. Okay.
So the 28-day challenge is perfect for that. With that, you also get the 10 minutes a day. So if
Mm-hmm.
you're just the program, the 28-day, the longer program is Monday, Wednesday, Friday, or 3 days a week. So whatever days you want, 3 days a week. So
Okay.
4 weeks. But if you want to do some more work in between to get a little extra, maybe you feel like you can do more, there's also the 10-day quick fix where there's just shorter 10-minute programs for you to do, 10 to 20 minutes. And then those are just extra to fill in if you need to, if you feel like you need to do more. So there's a lot of
Okay.
extra stuff in there.
All right. Okay. The the 21, the other one is which one is this?
So that is the 10-day quick fix, the 10-minute. I'm sorry, I totally forgot which was a 10-day or 10-minute because it does it in 10 minutes, but it's also meant to be done in 10 days. And
Yeah.
I totally confused myself. But it's you get regardless, you get it for free.
Okay.
And you basically get everything for free when you get the 28-day because the 28 days, like that one thing I feel like is the best one, and then everything else is like a complement for it. If you need a little extra, if you want to work now on your rounded shoulders, which usually comes with thoracic outlet syndrome, you can now work on that.
Hmm.
You have the TOS, you have the trigger point area as well, where you can look at the trigger point images and all that. And you have all that stuff. It's 10 minutes, 10-minute quick fix. There you go.
Okay. They have to start with this then first.
I believe so, yes.
Okay, good. Okay. Yeah, that sounds good. I need to do something anyway. Yeah.
Now, if you have similar problems to Patricia, then here's what you can do. First, you can try watching these other videos popping up in the corner or in the description below. Those other videos will help you with some basic self-massage techniques and the best ones that I found to help you get rid of that general pain, especially for thoracic outlet syndrome. Or if you have a special case here and you need to talk about it, then make sure to book a Zoom call with me where we can talk one-on-one about what's going on, what's happening, your history, and probably what the best approach is for you from my perspective as a sports massage therapist. And then finally, if you're just ready to get rid of your thoracic outlet syndrome right now, then make sure to check out the 28-day TOS challenge. That program right there will save you thousands because it's going to prevent you from having to go back to your doctors over and over again, guaranteed, or your money back. Check that out in the link below as well. If you have any questions, leave them in the comment section below. Other than that, I'll see you in the next one.